Hi, today I'm here with Kelly Bhatnagar, licensed clinical psychologist in private practice, and she's a consulting psychologist at Laurel School and an adjunct assistant professor at Case Western Reserve University. So today we're going to talk about eating disorders. Okay, so let's talk about the difference between disordered eating and an eating disorder.
That's a great question. What's the difference? Disordered eating is kind of unfortunately behaviors that many teens in particular kind of dabble in. This could include, restriction, chronic dieting, maybe purging or self-induced vomiting, over exercising, but it may not be at the frequency or severity to meet criteria for a full-blown eating disorder as per the DSM-5 diagnostic criteria. I think it's important to know, though, both are serious and both could lead to negative psychological and physical consequences, and intervention is needed at both ends of that spectrum.
So can you give us the criteria for what you would call disordered eating and then compare that to the criteria for a diagnosed eating disorder?
So with disordered eating, it could be a teenager that maybe when you notice any major change in a teen's eating behavior. So for example, I mentioned before, just chronic dieting that's starting to result in weight loss, but maybe not enough weight loss in order to meet criteria for anorexia nervosa, which by having them fall off of their growth curves. It could be just kind of a preoccupation with food that causes an isolation from friends or family, or no longer engaging in family mealtime practices, such as going out to restaurants or enjoying special family foods. The difference, though, again, would be this is kind of like the early stages of the illness where they're not actually maybe meeting the frequency, and this would depend on which eating disorder we would be talking about, anorexia nervosa versus bulimia nervosa versus binge eating disorder. But they may not be meeting these frequency, severity, or intensity to meet criteria for any one of those illnesses.
So, it's a little vague, which I'm sure, we can't be clearer about it because it is vague, but are many teenagers experiencing disordered eating?
Mhm. Whereas an actual eating disorder has a lower prevalence rate than many other forms of mental health condition, other forms of mental illness. Disordered eating actually has a very high prevalence rate, particularly among teenagers. We live in a very body-focused culture where, weight loss and this thin ideal is a very prominent ideal in our culture. So many teens, in order to kind of live up to these thin ideal expectations, may sort of dabble in these behaviors because they think they are being healthy, trying to achieve that ideal.
Can you suggest anything in a preventative way that parents can do in their house to like present a positive image of food?
Sure. I think parents kind of modeling on or adopting a flexible thought process surrounding food can really go a long way with teenagers. So instead of falling into categories or good foods or bad foods, really making room for all foods, just really focusing on moderation of certain foods, particularly for teenagers who sometimes have a tendency to go towards what we've categorized as unhealthy foods at times. But I think trying to have as many family meals as you possibly can. There's a lot of research that talks about the benefits of academic benefits, social benefits, and just family connectedness by being able to eat together. So having a lot of family meals. I think encouraging fun family activity, going on walks together and not really trying to frame the activity as a way to burn calories or to rack up the steps all the time, but more so, this is, especially during a pandemic, this is just good for our mental health. And this, the benefits of activity can just be helpful in terms of mitigating depression, anxiety, and using it as a stress relief.
How does a fun family activity have to do with healthy relationship with food and body?
Mhm. Well, I think particularly right now, there is a competition culture going on. Since we're all isolated and secluded, we have to become the best at something. So whether that's the best exerciser or the best baker, whatever that might be, and it really can kind of play into this diet culture that I need to be doing something to modify my shape or weight in order to be the best at something or to keep up in the competition world. But how I tell the families and teens that I work with right now, we're in the midst of a pandemic where really we should be focusing on compassion and not competition. So really thinking again of how activity can be beneficial towards mental health, not necessarily towards changing shape and weight, can really push back against that diet culture that we've all become accustomed to.
So that would be a story. I mean, it's always good for families to get out and do a walk together. But you're saying that maybe we can replace some of the I'm going to run for 10 miles with, is that what you're saying? I'll
Yeah,
go out with my family instead.
yeah, and do something that's enjoyable for the family and helps the family with, like I mentioned before, connectedness. A lot of the clients that I work with, we've been talking about replacing the word exercise with activity, since the word activity is not so related to the diet culture that we live in.
You mentioned before about good food and bad food. So, I mean, I think, we kind of all grew up with that concept.
Mhm.
And so how do we get out from under that?
Yeah, that's tricky. I think by first remembering that, good food or bad food or healthy food or unhealthy food is really a relative term. So some of the clients that I work with anorexia nervosa, what may be healthy for them may not be the same thing as a teenager struggling with pediatric morbid obesity. So remembering that that's a relative term can be helpful. And it's something that we just kind of have to check ourselves and remind ourselves daily, because it is hard to get out of that mindset that's been ingrained in us since the time we were small.
Is there language we should change that helps us reframe that food?
Something that we use in our practice as opposed to good or bad or healthy or unhealthy, sometimes foods and all the times foods, I think kind of leads to a little bit more flexibility too, but mostly the emphasis of in moderation, anything can be part of a balanced diet. But again, as long as we're doing it in moderation.
So when you say sometimes foods and all the time foods, I think of saying that to my teenagers and them rolling their eyes at me. But you work with teenagers. So how do they receive that? Are they rolling their eyes when they hear it?
I work with a lot of older adolescents, and I thought the same thing at first, like, oh gosh, this will never go over well with them. However, a lot of them find it really liberating to know that there's different language, that it doesn't have to be black or white or one or the other, and almost kind of gives a sense of freedom and it moves them away from guilt or shame from eating foods sometimes that are categorized as unhealthy food, and allows them to have a more open and a more balanced relationship with those sometimes foods. So far, so good, but knock on wood.
Okay, so right now you've mentioned COVID a few times. In your practice, are you seeing an increase of teenagers with disordered eating or eating disorders?
Yes. So, and more than anything, I think I'm seeing an exacerbation of symptoms in our existing clients. I think we're seeing higher levels of depression, higher levels of anxiety in the practice too. And this to me is just kind of all related to the feelings of isolation and the uncertainty that we're just facing in our world right now. There was a recent study that was published by UNC, Chapel Hill. Cindy Bulick was the author, that really talked about eating disorder clients in particular are struggling because right now they don't have access face-to-face time anymore with their healthcare providers. They don't have access to the meal support that they used to, and are adjusting to doing meals with their treatment teams virtually, and that's been a big challenge, and it's been really hard for our clients. The study said that people are just really needing more nutritional advice. So whereas being able to, we're so grateful that we've been able to stay connected and be able to offer care virtually. It does come with its challenges as well.
Are you seeing a difference like boys versus girls?
We're seeing the same patterns in both boys and girls. One of the big things we always say is that eating disorders don't discriminate. And even during COVID right now, we're still seeing a higher rate of or exacerbation of symptoms in boys similar to what we're seeing in girls.
Okay, so I am the mother of teenagers and I'm listening to all this and I'm still wondering, when do I worry? If this is like a cultural phenomenon and so many teenagers have disordered eating, at what point are there red flags that there's a point I should say, oh my God, it's time to call?
Yeah. I might reframe the question to when do I intervene? And I think that there's different levels of intervention based off of where we are on the on the eating disorder, disordered eating spectrum. So I would say as a parent, if you're noticing, especially during times of high stress like this, if you're noticing drastic changes in your child's eating or activity behaviors, so maybe not wanting to come to dinners anymore, or not eating in front of people, not going to restaurants, if you're noticing kind of a preoccupation or compulsive exercise, I think that certainly warrants the intervention of you need to ask about it at that point, and just do a check-in. Are things okay? I'm in a very empathic, non-judgmental way, not walking on eggshells surrounding these issues, but being very non-judgmental in your approach to it, but just saying, are you checking in? Are you okay? I'm noticing X, Y, and Z, and I'm a little concerned. Can we talk about this? And then if you're noticing outside of that conversation, these behaviors persisting and, and you're noticing that coupled with weight loss, or in kids and adolescents, equally as important, failure to make the expected gains for their developmental status, and I think that would certainly be the time when checking in with a mental health professional would be warranted. But it's like I always say to families, I would much prefer starting to work with the kiddo when it's still in the disordered eating phase before it transitions into a full-blown eating disorder. Early intervention in this with this illness is key. So the faster that a parent can kind of share their observations and get a child and get a child in to receive the help that they need, the better the outcome we will have.
So, as a parent, can I start with you and get some tools from you before I bring the kid in? Like, is there a way to kind of deal with it at home, having some input from you directly to the parent?
So funny you say that, because actually the first line treatment for kids and adolescents with eating disorders is something called Maudsley family-based treatment, which is a very parent and family driven intervention. We try really hard in the eating disorders world to convey the message that parents and families do not cause eating disorders. The parents, have when they come into our office, there can be so much guilt and so much shame around their child developing this illness. And it is really important that parents recognize that they didn't cause this illness. That being said, they can be the best possible resource for their child's recovery. Who else has their kid's best interest at heart than a parent, So really a partnership between parents and the treatment team is incredibly important for the well-being of a child. So I have many families that we start just with a parent consultation. Let's share what we're seeing. Let's give you some language for how to talk about it with your child. Here's when we know that this is something more serious and we need to start a more active or more formal evidence-based treatment approach. But consultations, I think, are really important to making sure that we're catching it at the right stage.
Dr. Kelly Bhatnagar, thank you so much for your time. This is such a challenging time for parents and for teenagers, and to have a resource like you is such a gift. So thank you so much.
Thank you, Sue. I really appreciate being here. Thank you.